This week, not only do we celebrate EMS Week, but also the 43rd year for Seneca County EMS. Seeing many changes over the years, one thing has remained consistent. The dedicated EMTs and paramedics are always ready to answer the call. 2023 brought even more changes to Seneca County EMS following the tremendous support and generosity of district residents with the passing of the EMS levy. Seneca County EMS now provides primary EMS coverage to the townships of Venice, Reed, Bloom, Scipio, Seneca, Big Spring, Jackson, and Liberty townships, currently staffing 4 ambulances and 1 Echo paramedic to respond to all emergency calls 24 hours a day, 7 days a week. Seneca County EMS would like to wish all fellow EMS providers a very happy EMS week and extend our gratitude for your continued dedication to providing quality EMS care to your communities. Without the dedication of many, we would be unable to provide prompt and effective emergency care to those in need.
As we know, emergencies can happen anywhere, anytime. Early recognition and action are key, and a bystander can provide that vital help until first responders arrive. But remember, never put yourself into a possibly dangerous situation. In these next clips, Paramedic Miller is going to do a few quick tutorials and go over some actions that a bystander can do. She's going to review hands-only CPR and bleeding control.
Hi, I'm Kendra Miller with Seneca County EMS. Today I'm going to be demonstrating for you hands-only CPR. The time that you may need this is if you come upon somebody who is unresponsive, not breathing, does not have a pulse. Follow along with the video if you would like to learn this life-saving technique. To begin, we're going to take our hands, placing our dominant hand over top of our non-dominant hand, interlacing the fingers like so. You're going to place the bottom part of the palm in the center of the patient's chest. From this position, you're going to push down hard and fast at a rate of 100 to 120 beats a minute, allowing for the chest to have full recoil. This means allow the chest to come back to its normal resting spot before you push down again. That is how you provide adequate compressions. If you have trouble counting in your head from 100 to 120 beats a minute, think about the songs of Staying Alive and Baby Shark. These songs will help you get to 100 to 120 beats a minute. Now I'm going to demonstrate for you how to stop the bleed. To begin, we are going to take our dressing and apply it to the bleeding area. We're going to press down hard and firm. With this direct pressure, if the bleeding is controlled, we will secure the dressing in site with a bandage. If bleeding is uncontrolled, we will grab an additional dressing, apply it over top the existing dressing, pressing down hard and firm. Once bleeding is controlled, we can again secure it with a bandage. If bleeding still is not secured, at this time, we may think about going to a more advanced way to stop that bleed. A tourniquet is the way to do this. A lot of your first aid kits now come with tourniquets. If not, you may have to be resourceful and use items that you may have around you, such as a belt. To apply a tourniquet, you want to open it, secure it at least 2 to 3 inches above the bleeding area, but not across the joint. You want to take this and get it as tight as you can initially. You're going to turn this wing until the bleeding subsides. You will secure it, place the Velcro over the top, and write the time that you applied the tourniquet. At this point, if you think that you need a tourniquet, you should be calling 911. Tourniquet should be applied if there is any bright red squirting blood, and if you cannot control a bleed with direct pressure. I would also like to demonstrate wound packing for you. This is done on penetrating wounds or wounds that are holes or too deep or large to be able to control the bleed with direct pressure. In order to do this, you will take your bandage, take the end, and start stuffing it into the wound itself. This is a painful process for the person that is having their wound packed, so do not be alarmed if they have some discomfort. You're going to continue to press down hard and firm until the bandage reaches the surface of the hole. Once you are to that area, you will then go all the way around the hole, putting pressure down as you wrap, and then securing it in place. This should subside the bleeding and could also be used when using a tourniquet as well if the bleeding does not stop with the packing.